Well, here in South Mississippi, we have a large military presence. We always have. We probably always will. I've got Eric Bowers with me here today. You at Gulfport Behavioral Health System, you're in charge of the Patriot Support Program. Tell us about that.
Yes, Patriot Support Program is a program that we started, that UHS started back in 2009 across our facilities across the United States. And the program is focused on active duty military and veterans that are in any type of mental health crisis that, it's a different, unique situation that we find those type of patients in, and we provide those treatments here at Gulfport Behavioral Health.
It's no surprise there are statistics for days and days and days about the challenges that our active duty and retired military veterans have on a minute-to-minute basis, hourly basis, on a daily basis. Right. What are you guys doing to help those patients here?
Well, the first thing we do, Chet, is make sure when they come in that they have we have the resources here to help them get through whatever crisis they may be facing. One of the big treatment programs that we're doing here is our EMDR treatment that focuses with our active duty military and veterans that are dealing with any type of anxiety, depressions, family separation. And that treatment, it could go from anywhere from 2 treatments up to 12 treatments. It just depends on the state that they're in.
Well, tell us about the Compact Act for Veterans. That's something that you guys take care of here as well.
Yeah, the Compact Act is something that was signed, Congress signed into law to where any veteran that is experiencing any type of suicide ideation, that they can be seen at any emergency hospital, any treatment facility at no cost to the veteran, as long as they are being honorably discharged from the armed force services.
So we mentioned veterans a couple of times. You guys will service active duty military as well.
Yes. Yes, we do service active duty military here in our community. We have Keesler Air Force Base here. We have our Naval Base here. And also we have down the road just an hour, it's Camp Shelby, that's a joint base. And so we do treat those active duty service members that are in those crises.
And let's not forget about our first responders.
Absolutely, yeah. Our first responders, most of them, as you know, most of them are service members, are veterans, and they have served and they have continued to serve our community. So we can't forget about them as well. We do treat them as well. We have a milieu unit where all our active duty military veterans and first responders, when they come here, this is where they stay. They stay on that unit. So because the treatment's a little different and the length of stay is a little bit longer, we want to make sure we're giving them the best care possible.
Eric, why is this important to you?
Well, I'm a veteran myself. I served 28 years in the military. I'm a Purple Heart recipient as well. And I actually was a patient back in 2008 in our other UHS facility in Texas, Port Laurel Ridge. And so after retirement, I started doing some work in the community with Wounded Warrior Project, and that opened up the door for me to come here and help service some of the, continue to serve. You never stop serving. So this is a way for me to fulfill my passion. Sometimes, you just never know what God's going to call you to do. So I think this is just one of the callings He gave me.
And I think it's important in such a large capacity, in a large area where there's a lot of military active duty and veteran. I think it's important that they, some of those folks are paying the price. If they're active duty, they pay the price as veterans. And that's a calling. They're doing work that the rest of us didn't get the calling to do. But thank heavens that they're doing it, because it is a special detail for those folks who are there to defend our country.
Yes, it's an all volunteer force. So, service members like myself, we volunteer to do it. And some of us do it a little longer than others, but we all experience most of the same things. We just want to make sure that the community understands that they're a special group of people, and sometimes they find themselves in crisis that they can't help themselves. So we have to provide that service for them in the community, because they are a part of the community. So we want to make sure that the community understands that when you see your veterans or you see your active duty personnel or your first responders, please understand that you never know what they may be going through. So make sure you shake their hand, thank them for their service, and give them a pat on their back.
Well, thank you for your service.
Thank you.
Thanks, Eric.
Appreciate you.
In addition to the wonderful programs they have here available for our veterans and active duty military, they also have employment opportunities. Cynthia Rinder-Leach is the Director of Human Resources.
Correct. Yes.
Tell us about what you have available here.
Wonderful. We actually have some amazing opportunities, and most of these are going to be clinical in nature. So we do have nursing staffing positions, mental health techs, which is part of our nursing team, outpatient therapy. We have a therapy role for outpatient master's level outpatient therapists. PRN positions available for recreation therapists, which are certified. And then we have some non-technical positions like a PRN receptionist and a housekeeping position. Many of our positions are clinical in nature, though, just because of the type of facility that we are.
And every single role really here under this roof is vital to the work that you're doing here.
Absolutely. We value each member of our team, no matter what position that they serve in. Each person is valuable in terms of the care that our patients receive. And we talk about that through our service excellence culture. You know, it takes a team, in essence, to care for our patients, and those that are part of that team involve every aspect of our delivery of care, whether it's hands-on patient care or support services teams. We're all involved in the care of the patient, and everybody understands that.
It's important because we talked about the interaction between the folks here that are working here and the patients, and even the smallest little interaction is important and could be what makes or breaks the care for that patient.
Exactly, exactly. Service excellence is the foundation for our culture, and so we promote that. We actually have an orientation going on, and that's one of the first things that they learn about is the culture of the organization, you know, where we actually are here to provide excellence in care for our patients. And we will find that the people that are drawn to this type of profession have that in mind, because these are special types of patients. They really have a connection to those who are suffering with mental health and behavioral health issues. So we're very fortunate to have a talented group of people, and I'm very proud of the people that we have working here for our patients.
And your employees are not only engaged here in the work you're doing, but you guys have a lot of outreach in the community. Tell us a little bit about what your employees do in the community.
We do. In addition to some of our, ongoing efforts, one of the things that we have going on now is just a partnership with our two community agencies. It's the Women's Resource Center and the Shelter for Nonviolence. We're doing a fundraiser for them for Mother's Day. It's called Movers for Moms, and it's not just us, but a lot of other businesses and industries in the community that are doing that. But things that kind of go unnoticed with us is that we do a lot of training. We partner with the community colleges, MGCCC, William Carey. We have USM, students that are here doing their training. So the clinical training, precepting is one of the things that we do to help support the continuing education for those people that are going into the professions.
Well, if you're looking for a job and this is the right fit for you and you're called to this, definitely reach out to them at that contact information that you see there at the bottom of your screen. You get to engage with the community as well, which is really important. So give them a call. Thanks, Cynthia.
Very good. Thank you.